Because if we answer that question, and if we march to that drummer, then advancing the common good means everybody. And it means that every child, and it means that every parent, it means everybody. And no one takes that claim. We have to go back to trying to create opportunities that allow people the education they need, the health care and health access they need, and the income they need. We've all sat with enough educators in our career to know that educators know what's necessary. You got to show up to school ready to learn. You got to be achieving at grade level in the 3rd grade. You got to make sure that kids stay in school in the middle years or in the years that follow the middle years when they start thinking about dropping out, and we got to make sure kids graduate. That's what we need to be focused on. If you think about the health area, we need to make sure that folks have access to health care. Health insurance, for sure, is one strategy, but access to health care. Preventable diseases, obesity, diabetes. We need to make sure that young people are substance-free. Alcohol, drugs, tobacco. Half of all the personal bankruptcies in the US are caused by a medical condition, a medical issue. They're tied together. But finally, I would say this about income and the social contract. Remember, the old contract was I had a job that allowed me to get to a certain place, and then everything else was support, safety net or support. And if we don't get ourselves focused back on the financial stability and independence that individuals and families need, social services can't do its job. At United Way of America, one of the things I've learned is no good idea ever starts here. It starts there. And what we look for is not to try to create the next big initiative. We look for United Ways in mass that are starting to work on something and jump in front of the parade. What you've been working on more and more, earned income tax credit, individual development account, job trainings, savings initiatives, matching those savings initiatives. So on May the 7th, we took that lead, went with Mike Durkin, the United Way CEO in Denver, Ann Wilson, the United Way CEO in the Bay Area of San Francisco, who had led a task force on helping us think through the next national initiative. What comes after Born Learning and Success by 6, and what comes after 211? The Financial Stability Partnership. And we launched it at the National Press Club in Washington on May the 7th. The interim IRS commissioner, his first official act was to stand with us on that podium endorsing this direction. IBM was there. Bank of America was there. The Annie E. Casey Foundation was there. Our technology partner, Nets to Ladders, was there. And we made a commitment as a United Way movement to help individuals and families increase their income through better jobs or public benefits, keep more of that income through savings initiatives and IDAs, and gain assets by helping folks get to college, own homes, buy cars, and so forth. We also put stakes in the ground. One of the things that I know we preach to local United Ways, and you share with each other, is that if you're going to make a commitment on, name the issue, education, health, income, whatever it is, you have to make a commitment on metrics. Make a commitment on what we stand for. So the commitment that we made was this. In the next 5 years, right now in aggregate, you invest $1 billion in financial stability type programs. Family support systems, job training systems, earned income tax credit, education support systems. In the next 5 years, we made a commitment to try to get that to $1.5 billion by shifting what we currently spend and increasing investment into those areas. We made a commitment to increase by 50% EITC enrollment, earned income tax credit enrollment in 400 targeted communities around the country. We made a commitment to reduce by 25% the number of families without bank accounts. You don't have a bank account, even if you get your earned income tax credit. We've got folks across the country getting 1 week loans at exorbitant fees in order to get their tax return. Billions of dollars lost. We've got to get folks banked. And finally, we made a 1-year commitment to increase by 25% the enrollment in public sector benefits electronically in 20 targeted states. I'm going to tell you a story in a minute about how technology can help us in this area. But we've got a technology partner in Nets to Ladders that will help local United Ways enroll people electronically in public benefits, earned income tax credit, health care, food stamps, and so forth. We can have that in place, accessible for every United Way within 2 years. That's the commitment we've made on the Financial Stability Partnership. But it is about partnerships, and the next steps for us are an Earned Income Tax Credit Summit and beyond in San Francisco in July. If you haven't heard about it, I encourage you to go online, take a look at it. We want local United Ways there, and we'd like you to bring a public sector partner. The City of San Francisco Treasury Department matches Earned Income Tax Credit returns in San Francisco. We've got to get local public officials there working with us. We're also now developing tools and resources for you, local United Ways, in order to roll out this Financial Stability Partnership across all of your communities. But let's make it real for a minute. There's a story in San Antonio, Lisa Elizondo. Lisa's with us today, along with Rebecca Brune from the United Way in San Antonio and Bexar County. Lisa was a mother first at age 15. She has 5 children. She was recently divorced. She works for the city of San Antonio. While working at the city, she heard about the Earned Income Tax Credit and the volunteer preparation sites supported by United Way. She took advantage of Earned Income Tax Credit returns. She got herself into financial literacy classes. She saved enough to put money into an individual development account. In the middle of all this, she has a fire that destroys everything, loses everything. She gets herself back up, back in the Earned Income Tax Credit program, finally gets $1,000 saved up, put into her individual development account. It gets matched by $4,000 going into the development account. She buys her first home. She continues to stay involved in the program. She gets her oldest daughter with an IDA account starting to save. Her oldest daughter gets $1,000 in her account, gets matched. She's going to nursing school this fall. Lisa Elizondo. It's not just about social services. I mean, it's about how do I start getting income, building some savings, getting some assets that allow us to get to the next stage of life. The United Way in San Antonio and Bexar County 5 years ago wasn't involved in the Earned Income Tax Credit at all. Today, 30,000 returns through their sites, all electronic, $45 million brought back into their community. More importantly, stories like Lisa's. If we can't see the wisdom in it programmatically, let's see it from a human perspective. How many Lisas are out there with this kind of potential, with this kind of opportunity to contribute back and sustain herself and her families? And if we'll think differently about that social contract, we'll make more progress. And it was all about partnerships. The San Antonio Federal Credit Union, the City of San Antonio, and the United Way of San Antonio and Bexar County. If this wasn't challenging enough, what we have to do locally, what we have to do nationally, I would suggest that our new contract, this new idea of how we'll work together with business and government and nonprofits and community, needs to be in a global context as well. Our role, if you think of the scale that we represent, 1,300 local United Ways in the US, $4 billion in revenue, United Way international affiliates in 46 countries, almost $900 million in revenue. With the kind of need that exists around the world, we have to be in a position to respond. Even if that wasn't compelling enough, our donors want us to respond. Not just UPS and FedEx and Deloitte and so forth, them for sure, but young donors, individual donors, people who want to be involved. We have to take advantage of our network.